In 2025, India might be seeing its first case of a virus called human metapneumovirus, or HMPV for short. This virus, which has been known to cause respiratory infections, is now making headlines as it potentially reaches Indian shores. The virus is not new to the medical community, but its presence in India is causing a stir among health officials and the general public alike. An 8-month-old baby in Bengaluru went to a private hospital showing signs of the virus. The baby was experiencing symptoms such as coughing, wheezing, and difficulty breathing, which are common indicators of HMPV. The parents, initially thinking it was a regular cold, grew concerned as the symptoms persisted and worsened. The hospital staff quickly isolated the baby and began a series of tests to confirm the presence of the virus. The Karnataka Health Department is keeping a close eye on everything. They have set up a task force to monitor the situation and are working closely with the hospital to ensure that all necessary precautions are being taken. Health officials are also coordinating with national and international health organizations to gather more information about the virus and its potential impact on the population. This news might be worrying, but experts say there's no need to panic just yet. Health experts are emphasizing that while the virus can be serious, especially for young children and the elderly, most people who contract HMPV experience mild symptoms and recover fully without any complications. They are advising the public to stay informed, practice good hygiene, and seek medical attention if they or their loved ones exhibit severe symptoms. HMPV often feels like a normal cold, and most people get better without any problems. The virus spreads through respiratory droplets, much like the common cold or flu, and can be prevented by following standard health guidelines such as washing hands regularly, wearing masks in crowded places, and avoiding close contact with infected individuals. Families are encouraged to remain calm and take preventive measures to protect themselves and their communities. Human metapneumovirus, or HMPV, is a virus that mainly affects our lungs and airways. Don't worry, it's not a brand new virus. HMPV has been around in India for more than 20 years. It usually pops up during the winter months, just like the flu or a common cold. Most people just experience mild symptoms and get better with some rest and care at home. HMPV spreads through tiny droplets that come out of our mouths and noses when we cough or sneeze. If someone nearby breathes in these droplets, they might get infected. It can also spread if someone touches a surface with these droplets on it. After catching HMPV, it usually takes 3 to 6 days for any signs of illness to show up. HMPV is usually not serious, but some people need to be more careful. Babies and little kids are more likely to get really sick because their immune systems are still developing. Older people, especially those with other health issues, should also be careful. People with weaker immune systems, like those on chemotherapy, are also at a higher risk from HMPV. Right now, there's no special medicine to cure HMPV. The focus is on easing the symptoms and helping the body fight it off naturally. Doctors usually recommend rest, drinking lots of fluids to stay hydrated, and taking over-the-counter medicines to bring down fever and congestion. In most cases, HMPV goes away on its own with some home care. Recently, China has seen a sudden increase in HMPV cases, especially among children and the elderly. Hospitals are seeing many patients with breathing problems, putting a strain on their resources. Health authorities in China are working hard to manage the situation. They say this rise in cases is normal for the time of year. The Indian government is keeping a close watch on HMPV, a respiratory virus that has been causing concern globally. This virus, known for its impact on the respiratory system, particularly affects children and the elderly, making it a significant public health issue. The government has been proactive in its approach, ensuring that all necessary measures are in place to monitor and control the spread of this virus. They are taking steps to prevent it from spreading widely. This includes extensive public awareness campaigns aimed at educating the population about the symptoms and preventive measures. Health workers are seen disinfecting public areas, a crucial step in minimizing the risk of transmission. The government is also focusing on community engagement, encouraging people to report any symptoms early and seek medical attention promptly. The Ministry of Health has put testing in place to quickly find and confirm cases. Testing centers have been set up across the country, ensuring that even the most remote areas have access to diagnostic facilities. The health minister has been actively involved, announcing new health measures and guidelines to keep the public informed and prepared. These measures are designed to ensure that any outbreak is quickly contained and managed. They've also given advice to hospitals and clinics across the country, providing them with the latest information and protocols to handle potential cases. Training sessions are being conducted for hospital staff, ensuring that doctors and nurses are well prepared to deal with HMPV cases. Medical briefings are held regularly to update healthcare professionals on the latest developments and best practices. Hospitals are preparing isolation wards and setting up for emergencies, making sure they are ready if cases come up. This preparedness is crucial in preventing the spread of the virus within healthcare facilities. The staff is trained to handle emergencies efficiently, ensuring that patients receive the best possible care while minimizing the risk of transmission to others. The Indian Council of Medical Research, or ICMR, is keeping track of HMPV patterns, analyzing data to understand the spread and impact of the virus. Researchers are working tirelessly in laboratories, studying the virus and developing strategies to combat it. The data collected is crucial in making informed decisions and planning effective interventions. A special group called the Joint Monitoring Group, or JMG, is meeting to discuss the situation and plan a nationwide response. This group comprises health experts, government officials and other stakeholders who are working together to coordinate efforts and ensure a unified response. Their meetings are focused on assessing the current situation, identifying challenges, and developing strategies to address them. The National Emergency Response Team is also actively involved, planning health measures and coordinating with various agencies to implement them. Nationwide health campaigns are being planned to raise awareness and educate the public about HMPV. These campaigns aim to reach every corner of the country, ensuring that everyone is informed and prepared to take the necessary precautions. The collaborative efforts of these various groups and agencies highlight the comprehensive approach India is taking to tackle HMPV and protect its population. Health experts say it's really important to do simple things to stop HMPV from spreading. Washing our hands often with soap and water is super important, especially after coughing or sneezing and before touching our faces. When we cough or sneeze, we should cover our mouths and noses with a tissue or our elbow to stop droplets from spreading. It's also best to avoid close contact with anyone who's feeling unwell. Remember, most people who get HMPV have mild symptoms and recover fully. This means that for the majority, HMPV is not a cause for alarm. They might experience symptoms similar to a common cold, such as a runny nose, cough, or slight fever. These symptoms usually resolve on their own without the need for medical intervention. It's important to stay calm and not panic if you or a loved one shows these mild symptoms. Rest, hydration, and over-the-counter medications can help manage these symptoms effectively. But if you or someone you know has difficulty breathing, it could be a sign of a more severe infection. Difficulty breathing is not something to take lightly. It can indicate that the virus is affecting the respiratory system more aggressively. In such cases, immediate medical attention is crucial. Don't hesitate to seek help if breathing becomes labored or if there's a noticeable shortness of breath. A high fever that won't go down, which is another red flag. Persistent high fever can be a sign that the body is fighting a more serious infection. It's important to monitor the fever closely and use fever-reducing medications as advised by a healthcare professional. If the fever remains high despite these measures, it's a clear indication that medical intervention is needed, or a cough that's getting worse, especially if it becomes severe or is accompanied by chest pain. A worsening cough can indicate that the infection is progressing and affecting the lungs more significantly. This is particularly concerning if the cough is persistent and doesn't improve with time. In such scenarios, it's essential to consult a healthcare provider to prevent complications. It's important to see a doctor right away. Early medical intervention can make a significant difference in the outcome of the illness. Doctors can provide treatments that may not be available over the counter and can offer guidance on managing symptoms effectively. They can also perform necessary tests to determine the severity of the infection and recommend appropriate care. It's always a good idea to stay updated about HMPV from reliable sources like the Ministry of Health and Family Welfare. the World Health Organization, and trustworthy news sources. Staying informed helps you make better decisions about your health and the health of those around you. Regularly checking updates from these sources ensures that you have the latest information on prevention, symptoms, and treatment options. Knowledge is power, and being well informed can help you stay vigilant and prepared.